Hello, I'm John Urbans, President and CEO of Greater Fort Wayne, Inc. Welcome to the Roadmap to Healthy Reopening webinar series. Today we'll be focusing on personal care services. I'd like to thank our partners in this endeavor, Parkview Health, Greater Fort Wayne, Inc., the Northeast Indiana Regional Partnership, and the Allen County Department of Health. Since last week's webinars, Governor Holcomb has rolled out the Back on Track Indiana plan. Allen County and all Northeast Indiana counties entered stage 2 on Monday, May 4th. That has helped clarify timing on reopening, but has also created more questions on how to reopen. That has led us to offer an expanded series, and today the team will help answer questions that have risen for personal care industry that is allowed to open next week on May 11th. Real quick for housekeeping, please hold your questions until the question and answer segment that will be the second half of the webinar. We've received a number of questions ahead of time, so we will work through those, and then we will use the Q&A tab that's located at the bottom of your screen. Following the webinar, you will be receiving an email that contains a survey, a link to the recording, and a copy of the slides from today's session. I want to thank all the participants for submitting questions in advance. They served as a guide for the Parkview team and the Department of Health team to develop the content for this webinar. While you may not hear your specific question asked, we hope the information shared will address your most pressing concerns. I'd like to go ahead and introduce Jolene Succo, the Chief Innovation Officer from Parkview, who will get the program started. Jolene?
Good afternoon. Yeah, good afternoon. I'm excited to be here with you talking about personal services. I know I'm excited to return back and get my haircut very, very soon. So like John said, this is really the second part of a series, and I highly encourage you to see the earlier series. But I want to say thank you for everything you've done to help slow the spread of coronavirus. I also want to share with you a little bit about how we're doing here at Parkview and how we're thinking about things. So we've been fortunate that due to the hard work of our community and staying home, we've been able to handle the surge, and we're prepared to handle any surge that comes. On Monday, we have begun to gradually do more elective surgeries, and we're feeling pretty good. And as you can see in our COVID impact meter, we're proceeding with caution. We're also starting to see people come back to the emergency room, and this is critically important because we're seeing people delay care. Another care delivery option that has really dramatically increased over the last month is our virtual health. And while we've had virtual health for 2 to 3 years, in April we topped 25,000 visits. So if you're in need of care, many options to receive care, and I encourage you to use virtual health should you need care. So as we think about getting back to business and opening the parts of our organization that have been closed, we have a few guiding principles that we're thinking about. First is that the virus is here with us. It's in what's known as community spread, meaning it's not really limited to one place or area, and it's really hard to pinpoint the specific source. So it's just part of our everyday new normal. We also know that a vaccine is probably at least 12 to 18 months away. There's no herd immunity, and we expect that there's going to be some surges, and we expect there's going to be some bumps. And our goal is to keep these surges low and as many people as safe as possible. So we're continuously implementing and evolving safe practices to help our employees, customers, and our community. I'm going to talk a little bit more about this at the end of the presentation, but we want to be here as your partner in how you reopen safely and wisely. We've launched Parkview Business Connect to share the things that we've learned as we've thought about the many facets of our organization, and we're also putting up the best of what others are doing. This is going to be a living and breathing document full of people consideration, workplace considerations, and we've launched a hotline for questions that includes both phone and email. We recognize we're operating in a very dynamic time. Information is changing on a day-to-day basis, and sometimes it's conflicting and confusing. And our goal is to be a trusted source of information and dialogue partner for you as we get back to business and reopen our state. With that, I'm going to turn it back to you, John, to talk about the Back on Track, Governor's Back on Track plan.
Thanks, Jolynn. Yeah, as Jolynn said, obviously things are changing very quickly, and we're in a dynamic process. Last week, Governor Holcomb rolled out the Back on Track Indiana plan with a five-stage process. As we said earlier, we are currently in stage 2. If we go on to the next slide, the governor laid out really 4 guidelines that are going to determine how we move forward through this process. Those guiding principles are about the number of hospitalized COVID-19 patients. Has it decreased for 14 days? The state retains the surge capacity and make sure that we have critical care beds and ventilators on hand, which we currently do in the state. Making sure that the state continues to have the ability to test Hoosiers that are COVID-19 symptomatic. And then healthcare officials make sure that they have a system in place to contact all individuals who test positive for COVID-19 and really focus on that contact tracing. So as long as these pieces are in place, we'll continue to work through that process that the governor has talked about. As I mentioned, we are in stage 2 right now. So beginning on May 4th, in all counties except for Cass County, Lake County, and Marion County, different businesses will now start to be able to be opened up. Those other counties will start to open up later in the month of May, depending on how things track in those communities. Some of the overarching guidelines for all that the governor has talked about. Individuals 65 and over and those with high-risk health conditions should remain home whenever possible. The governor does recommend face coverings in public, doesn't require it. There's a number of stores that are requiring it. Want to make sure that we're continuing to practice social distancing and good hygiene. A lot of what we talked about in the last webinar series was about that social distancing, how we prepare our businesses, how we just make sure we're doing the standard hygiene to keep things clean. Currently, social gatherings of 25 people is the maximum with social distancing. Essential travel restrictions have been lifted, and he's encouraging people to continue to work remotely whenever possible. So that's something that we should still consider. Now, that obviously cannot work for a lot of industries, and that's what we're going to be talking about today. On May 4th, manufacturers, industrial operations, other infrastructure, we're all able to open as long as they're following OSHA and CDC guidelines. The state's starting to reopen the Bureau of Motor Vehicles. Public libraries need to start following the CDC guidelines and develop their own policies. City and county local governments are going to start to be open soon. Retail and commercial businesses can now start to be open at 50%. I know that Glenbrook locally is going to be opening up tomorrow. So we're going to start to see things open up. And then obviously starting tomorrow, religious services can start to take place as well. Obviously, as long as you're considering the social distancing guidelines. What we're talking about today, May 11th, is going to be personal services such as hair salons, barbers, spas are going to be able to open up. Restaurants and bars are going to be able to open up at 50% capacity. So we're going to start to see continuing movement on this as long as those 4 guidelines that the governor talked about continue to move in a positive fashion. So now we're going to spend some time talking about the personal services industry and specific questions that maybe could be answered there. One of the things, just one more quick update, we've talked a lot about personal protective equipment, and we do have resources on our COVID-19 resource hub on the GFW Inc. website that points you to a number of local industries that are producing masks, for example. It also has a direct link to the Indiana marketplace, where businesses of 150 and fewer can get online and gain access to masks, sanitizer, face shields, and other supplies that may be needed as they start to reopen. So that is a great resource that's out there that the governor has put out through the Indiana Economic Development Corporation, and I would recommend that you visit that site if you're having trouble finding personal protective equipment. So with that, we're going to turn it, we do have a couple more webinars that have been recorded. We have a few more coming up over the next couple weeks that we will be completing as well. You can see that on our website there at webinar.gfwinc.com. If you want to view any of the past recordings or view any of the slides from those webinars, that information is all there for you to view. And with that, I'm going to turn it over to Dr. Mike Knipp, who's the Chief Medical Officer with Parkview Total Health.
Thanks, John. Hi, Dr. Mike Knipp here, coming to you from our socially distanced webinar studio. I have a bit of a vested interest in this webinar today because from well beyond a social distance length, you can tell I need a haircut. So we're happy to get everybody back and going as they can into the salons and other things like that. So this slide here real quick. So as we know, Monday, so to speak, the lifeguard's saying everybody back into the pool. Before we run and cannonball in, this is a helpful guideline that is really to say, take a pause for a second and do a checklist to see, are you ready as a business to reopen? As you can see, this is something you can find landing on our website, Business Connect, to just help you go through here and make sure everything is full steam ahead and there's an all clear. Okay, so if you've seen any of our other webinars, we've brought out this concept of a hierarchy of controls, which is an approach to any sort of hazard that you could encounter in the workplace. Here at Parkview, this is encapsulated really well of our philosophy of more than a mask. As you can see there, we have 4 different tiers. Just real quickly to review: elimination, we're eliminating exposure to the hazard; engineering, we're isolating people from the hazard; administrative control, we're changing how people work regards to the hazard; and then the buzzword everyone's gotten familiar with is PPE as a strategy to help protect people individually. Okay. So I want to call it a couple things before we even get into this slide here, which this encapsulates some guidance that Dr. Holcomb's given to the specific industry. Three main points here. The first one is to, when you find a solution for your workplace at whatever level it is, you want to make that healthy and safe, optimal choice as automatic and easy as possible for both your patrons and your coworkers. The second point is look within for solutions that may untie your Gordian knot. It could be the person who's their first day on the job that comes up with a solution, or a patron who they literally are going to be looking at your workplace with fresh eyes because they've not been in there for a while. The third thing to call out is to be very open and transparent with your patrons and your employees of what you're doing to make them safer and healthy. Just to highlight just a couple here, for like elimination, for example, not having sick folks, either patrons or employees, be in the workplace. Engineering are certain ways to possibly isolate. And another, I guess a fourth point would be any solution or strategy should not prevent your coworker from performing their essential job task and function safely. So the point being with engineering, plexiglass barriers, you may have seen those or heard about that. Do you separate with those? You just want to make sure people can still safely do their job. We've internally, again, we've applied these strategies to what we do, and again with Dr. Holcomb's guidance here is a way to apply it to what you do in the personal service. Administration, just real quick, this would be changing how people are in and out of your business. One very common thing is just having an appointment-based strategy right now, and making your hours maybe a little bit different to limit how many people are in your salon or the like at one time. Finally here, PPE or personal protective equipment. And so many employers, and John just gave a helpful reminder on where to find places to locate this, are requiring face coverings for their employee and also for their customers. With The face coverings, it really works best if everyone is wearing one for what we call source control, meaning I'm protecting you from me and you're protecting me from you. So just for a real brief second, for an example, what our outpatient physical therapy has done, they've adopted a lot of these strategies, taken a very focused look at the hierarchy through the more than a mask lens, and developed some great solutions to continue offering excellent patient care to every person every day. So example, you see some of the same sort of things. The symptomatic folks are staying home. They are having just the patients come in, the family members wait in the vehicle. There's virtual care if that's an option. They've changed the way the waiting rooms look to ensure social distancing. These may be a floor cling that instructs you where to stand. Again, the very optimal safe choice is very automatic because you just look where to stand. Schedules are modified to allow changeover, and that also allows for good surface cleaning and things like that. The other thing is to encouraging and requiring hand hygiene for both provider and the patient. Again, just real quick with the PPE, all the therapists are wearing those procedure masks and gloves. Speech therapists similarly needing what's done to practice safely what they need to do for their patients. And we're asking patients all to wear masks, either their own or we are providing one when they come in. Having gone through that, I believe it's time for Q&A. So John, I'm going to hand it back to you, sir, virtually, of course.
Yeah, Dr. Knipp, thank you for that brief overview. You know, we really wanted to spend time today on your questions and getting you answers for those. So we've got a great team from Parkview on the call today. We've got a great team from the Department of Health on the call today that are going to help us answer questions that you've already submitted. And then also, like I said, the Q&A tab at the bottom of your screen is active. So if you have a question, please go ahead and submit that. We want to make sure that we're getting the information that you all need. You're the folks that are going to be opening up, going to be starting to see customers, and are now going to be on the front lines of this as well, in working to keep yourself safe as well as your customers safe. So we'll go ahead and get started on that, on the questions, and then again, please feel free to use that tab at the bottom to submit anything additionally. You know, the first question that came in is how do we encourage our customers to return? That's obviously going to be a big issue now that a lot of people have gotten used to being separated, being away, starting to have questions about how do I get out there? Is it safe to get out there?
So this is Dina Jackway, and I'm the Chief Community and Human Resource Officer here at Parkview, and I'll take a first stab at this question. Dr. Knipp may have some additional comments. I think the first, really, as we think about individuals going out into the community, the power that you have as a business to communicate all the safety measures you're putting into place really begin to allow those customers to feel like they're safe to come back. I know we were all excited to hear the announcement in terms of those personal services and some of those great things that are in our community, but it's really important as a business to communicate to your customers how you're going to keep them safe when they are, because it will take one time for that experience not to go well, for them to rethink maybe going back out or perhaps even not coming back to your business. So you're really thinking about not only communicating the what, but the why that you are asking them to do those things. You could do that on social media, you could do that on text to your customers, emails, phone, when they're making their appointment. You could be doing that at the time you're confirming their appointment. You can do all of the above. I think you cannot underscore the importance of communication. And I, perhaps along with many of you, have also received incentives or discounts for those places that you might frequent that are now reopening. So consider being able to put out there a way to incentivize individuals to come back, perhaps a complimentary item or a discount as they're re-engaging back with the businesses. Here's just a really good example. We're just giving a few examples. In Touch Salon had shared using some of their social media and texting to their customers. This was actually from Instagram, sharing what they were planning in terms of all phases, what to expect as customers were coming back in to the salon. Here's another example from the DuPont Veterinary Clinic. This is a great way to show the safety measures and expectations that those coming into the clinic. It's always great to share in advance so no one's surprised. You don't want a customer to be surprised when they walk in the door and how they're going to, as Dr. Nip said, see your business with fresh eyes for the first time. So you really only have one opportunity to do that well as they're coming back in. So sharing those safety measures are very important. And then here's a great example of the Woodhouse Day Spot, just providing a incentive or a discount off of a service for a limited period of time. Again, just a way to get people back into the business. And then finally, this is a great link related to Parkview. So we have some guidance out there ready for a haircut. Read this first. And I was just sharing earlier with a group. So I have someone that does my hair that's already reached out and actually provided the Parkview link for all of his clients to read before scheduling an appointment. So this is just a great resource for you to use and share out there on your social media.
You know, we can think about all those things, and those things are great, but at the end of the day, we're going to be bringing people into our places of work. What are some of the simple steps we can take to ensure that only healthy people are coming into our business?
This is Dr. Jeff Ward. This is a great question, and really is something actually that we do with our patient encounters. So we reach out to our patients in advance, and we just simply ask them if they have any recent symptoms. Have they had a fever, cough, shortness of breath, anything that might indicate that they would be ill. And we can use that to ensure that we are prepared to send them to the right place if they are ill versus if they're not ill and they're coming for just a routine follow-up appointment. So that's something that each business can consider as you do that confirmation, to simply say, you know, either instruct your client if you have any of the following. This may be simpler. Just instruct your client. If you have any of the following signs or symptoms, I would ask that you please cancel the appointment and we will reschedule you when you're well. That way you're not really asking directly, you know, personal health information. You can just simply say, if you're sick, please stay home. We want you to recuperate. We can see you at the salon or the shop at another time. Post instructions, if you're going to have people come, you know, if you want them to wait in their car until their appointment, for example, make sure you provide those instructions in advance. You know, again, having that posting to say, before you come in today, thank you for choosing our business, but if you have a fever, cough, shortness of breath, we would ask that you please cancel your appointment, come back another time. Again, that way you're informing the client, but you're letting them self-screen and make the choice regarding when it would be appropriate.
One of the things that's been talked a lot about is social distancing. And that's easy to talk about. It's easy to do in a lot of environments. But if I'm delivering a one-on-one service like a haircut or nails or a massage, if I'm a personal trainer, how do I incorporate that into what I'm doing?
This is Dr. Board again, and we think about the hierarchy of control. So, you know, we've talked about elimination, which would be things like self-screening your clients or customers before they come to your place of business for services. That's an elimination strategy. You can have people waiting in their car, which is an administrative control to help with social distancing, or reposition chairs in the waiting room, and hand hygiene. But really, there are services, these have to be inside of 6 feet. So this is where that last line of defense, the personal protective equipment, comes in. And really, it's source control for both the customer and for the employee. So masking both the customer and the employee, since they're both going to be within 6 feet, for protection of both parties. And then also attention to hand hygiene, prior to service and, both before and after conducting that service. If you can, another strategy, for example, many of our care providers that provide hands-on care may wear scrubs and change out of those scrubs when they go home, so that, again, you can make sure that if there's any contamination on your work clothing, that you have a change of clothes for home. So those are just some steps that you can consider.
We had one question come in, and maybe Mindy, this would be good for you to answer this one. If a provider tests positive, do they need to test negative before returning to work?
That's a good question, because initially there was some guidance that there did need to be some negative testing before certain folks could return to work. That's no longer required. If they did test positive, they'd be in isolation. We'd be working with them, or at least the State Department of Health or us would be working with them. And when they're fever-free for 3 days without the use of medication to reduce the fever, and then also 10 days have passed since the initial onset of the symptoms, that's when they're released. So unless there's some extenuating circumstance, but there is no negative test required to return to work.
Okay, thanks for that. Next question, how should we be cleaning in client areas and other common areas?
Sure. Hi, it's Dr. Nip. So the FDA has put out a real nice list of cleaners that will get the job done. If there are, I guess, good things, this virus is not, super difficult to get rid of if you're using the right tool for the job. In a second, the next slide has another decision tree to look at that. But the other thing, to bring back another concept called the high touch area, these are places that are touched a lot, which may need a little extra bit of attention. I also want to introduce a word called fomite, which at the outset sounds like what alien race Dr. Board on Star Trek or something, but it's any sort of object an organism, bacteria, virus could be on. And these are quite found everywhere in a salon, like we have there, the chairs, the cape, scissors, all those sorts of things. So those are other things to be cleaning. I know that's usual practice to, spray the clippers or do that, but you might just pause and do that. Keep a little bit more mindful of that. And then here's this helpful cleaning guideline. So it should key to the area. You may need to take, again, fresh eyes on your own workspace to see what is considered high touch and less touch to set up your cleaning schedule. I have another question I'm going to look at too. Someone asked, do we need to use disposable capes? Well, I'm going to say definitely maybe. We would need to understand if those can be easily, completely, and regularly cleaned with an appropriate cleaner. If that answer is no, we may need to throw away and use just disposable one time. If there is a way to clean those consistently that meets all the guidelines from CDC, FDA, I think you could do that, but it may be easier to just go to the disposable based on your specific situation there. Oh, hi, go ahead.
Hi, I'm Gail Waldecruz. I'm the rehab director for Parkview. One of the things when it comes to cleaning that I think everyone needs to be aware of, the temptation to wipe off the wet cleaning solution to speed things along a lot of times negates the effectiveness of that. And so please read the directions on your disinfecting solutions. And if it says that you have to leave it in on the surface and it has to dry for 10 minutes, that's going to make an impact on your scheduling and how frequently you can bring people in. So please be sure to read the directions on your cleaning solutions and follow those guidelines.
If I could, that's a great point, Gail. If I could piggyback too, again, creating that experience for your patron to say it may just be a little bit of an extra wait to get you in because we're waiting for this cleaning to set for the 5 minutes or something like that. But it all flows together to create the best experience and the safe experience for you and your patrons.
Yeah, and then think also about other, other high touch areas. So for example, in a hair salon, it's not just the chair and the seating, it's also the sink. If, for hair washing, having a process where it's easy, where you might, use a wipe with an approved cleanser to wipe that sink down between use for each customer, and also making sure that where possible you limit or eliminate common use items. So generally speaking, everybody's using their own set of scissors, clippers, etc. So they wouldn't, you don't run the risk of something being passed from one person to the next without cleaning occurring between uses.
Could I add one more thing? I'm sorry. I don't know if waiting room, did we talk about magazines and things like that? Probably trying to remove those if you can. A lot of salons have toys, but again, if you're following a plan, you're not going to have anybody but your client in there. But again, it's just the bare minimum for what needs to be in your waiting room. If it's not there, you don't have to clean it, right?
Yep. Beverages, if you provide coffee, tea, water to your clients, making sure those are single serve, single use. Because if it's just a water cooler where I come up and I'm handling the spigot, the next person comes and handles the spigot and things like that, the coffee pot, everybody's coming and grabbing the handle because it's not a single serve type of thing. Those are things you have to be mindful of and you might want to eliminate.
This next question, I think, is a great question and probably hasn't been talked a lot about. I know it's very easy for me to forget to change the filter on my furnace at home. How should we be thinking about our HVAC systems in facilities like this and hair dryers, kind of getting to that air quality piece of a business?
Sure, great question. We've had this come up a couple times, but it's going to be definitely a concern in a salon area. To not get into the industrial hygiene of air exchanges and those sorts of things, but just if there's any concern, you might consider getting an air filter with HEPA on your main unit. That is going to, I'm not going to say it's exactly like an N95 respirator for your air exchange, but it's designed to trap and keep out particles from a shared airspace. So it's basically the same principle, but it's kind of covering the window versus you wearing a mask inside your house to keep out the pollen or something like that. And then obviously here you want to match the unit for the space, as well as how many people are going to be there. And then the third point is very good. If everyone has a mask on, source control, you're kind of stopping it at the source as best you can. And so if there's no or minimal particulates coming out, it's hard for the hairdryer to spread those. And you could also, the opt-out point, which is there, is good. And you may, if for a while, I've seen some places say, we're just doing haircuts, we're not doing full shampoo or perm or something like that. You may just want to phase things in, because again, if it's making, you're reading the room, so to speak, it's making patrons or your employees uncomfortable to think about doing some of those services, you might just start with a basic set and then just kind of phase in things as you go forward.
Yeah, the next question has to do with PPE. Should folks be wearing gloves when they're delivering these kinds of services? And I'll throw in one of the online questions. How about face shields? Are those things that should maybe be come standard in some of this service provision?
This is Dr. Ford. I'll start with the face shields. I think you really have to look at what type of activity that you're doing. So, I would see a face shield is really being important. If you're doing something that what we call an aerosolizing procedure that would involve where you're really close to the head or face of the client, then a face shield might be worthwhile, but certainly not required if you're not doing something that would be likely to present that risk to you. So it's going to depend on the activity. If you're going to be behind the client, for example, if they have a mask on and you have a mask on, there's good source control. A face shield may not be required. So I think you just have to look at what type of work activity you're engaged in. But a face shield, if you're going to have splatter or something like that, particularly if you're working, with a chemical to prevent eye, provide some eye protection, is certainly a good option.
One of the questions that came in, and I don't know that we have an answer to it, it came in online. Gyms can't open until May 24th. If it's a personal trainer situation, can they work one-on-one with somebody before that time? I don't know, Mindy, if you know an answer to that, or maybe that's a question we need to get back to Aaron on.
I think it might be something we might need to get back with folks on. There's a little bit of a liability with making some of these interpretations with the lack of guidance so far. There's some conflicting information in the order. So it's a really good question because it's more of a personal service versus a center. So I understand why it's being asked. But if it'd be okay, I'd like to confer with some folks and get an answer back that is thoughtful.
I think that'd be great. And Aaron, we have your contact information, and we'll have Mindy get back with you on that one specifically. Maybe stick on the personal trainer and gym side. How about wearing masks or other challenges that personal trainers and gyms may have?
Don, this is Gail Aldecruz again. I just want to add something for the personal trainers, and they're doing a one-on-one visit. There are a lot of opportunities for virtual visits, and I would encourage personal trainers to utilize that technology. They our therapists, all three disciplines, physical, occupational, and speech therapy, have been continuing their relationship with their patients by utilizing virtual visits. We have the added requirements for HIPAA and not having a secure site, but with a personal trainer, they may be able to do something with Zoom or even with some of their iPhones and be able to continue their client visits along with that. So that would be my suggestion. And then we don't have to worry about in-person transmission at all. As far as personal trainers and their gyms, when that does open, I would encourage the same guidelines that we're using, which is mask. Make sure that the person you're working with is masked and the trainer is masked, just to eliminate that transmission. And I think it keeps everybody feeling safe that's in the same area when that opens. And of course, it's going to be really, really important that people continue to clean all their surfaces between their clients. And I know that that's a little bit difficult when people are going to be rushing back to their gyms because they haven't had the opportunity to do that. So making sure that you limit the number of people in the gym and that they're all being compliant with the cleaning.
So that's a really great point, Gail. The tongue-in-cheek joke we've had is the COVID-19. The 19 actually refers to the weight gain everyone has. So that's why, again, they're itching to get back into the gym. I just wanted to add one other thing, that positioning is also another, I guess that would be administrative control. If the trainer isn't standing directly in front of the person, where it may be hard for them to wear a mask because of the heavy breathing, their breathing zone and or coughing zone, so to speak, should be at a, I don't know, if you're at perpendicular to that person or standing behind, directing them, it keeps you out of that by and large. Just another consideration to think of. Can I take that? So we have a question that just came in about fans during exercise sessions. So that's a really good point. Is there a definite spread if people are coughing? There's definitely a theoretical one if it's possibly blowing the air around. Things that may help that, obviously air conditioning is not free, but we can do things like limiting how many people are in a session. Less people in the room is less body heat generated. We know fans help with sweating, which is one of our body's responses to exercise, but also regular water breaks to help use other cooling methods, have people step out of the exercise room, maybe in a staggered fashion, or do things like that, or have maybe an overhead fan versus a fan directly pointed at breathing level or person level that is blowing around everyone's when they're exhaling. Good question, though.
You know, maybe we could talk about selling products. What should we consider when it comes to products we use and sell?
This is a good question. It's something that's easy to overlook. But again, you know, looking at your place of business and thinking about what are all those things that multiple people might touch or use throughout the times that you're open. And so, for example, one thing that we would recommend that you do is remove product testers. So testers of hand lotions or things like that multiple people, you know, would use. I would remove those. Limiting the number of products on display so that if you do want to wipe those down, it's a less burdensome thing to do that. You can have, you know, several, you know, models, say, of something that you are marketing, but, you know, have most of the stock behind the counter so that you don't have as many high-touch surfaces you have to worry about. And then also just providing those regular cues to your clients for hand hygiene, having hand sanitizer, a little sign there, you know, please be sure to clean your hands, having hand sanitizer at the checkout counter, et cetera, can help promote the right behaviors to keep everybody safe while they're in your place of business.
This isn't unique to personal care services, but can you talk just a little bit about how we keep ourselves safe in break rooms?
Great question. This is something that we've been implementing here at Parkview Health. So we limit the number of chairs in the break room. If you have a lot of people that use a common break room area, one of the things you can do is stagger break time so that you don't have, you know, everybody in there between 12 and 1, and maybe you have somebody come in 11:30 at 12, 12:30, 1 o'clock to spread people out. Having cleaning materials ready and on hand. So Dr. Nip and I were in a small meeting earlier today. We were socially distanced, and we sprayed down the table and wiped it down at the end of our meeting, and that's become part of our standard work. So having those cleaning supplies at hand, performing hand hygiene before and after eating, getting rid of those common use high touch items in the kitchen if you are in the break room area, if you can. And here are some good examples. So think about water fountains, water coolers, coffee makers, microwaves, so that, you know, you either have a method to clean it between uses, or if it's a common high touch item you really can't clean, is it can be eliminated or substitute another single-use product. So, you know, maybe instead of using one water cooler where everybody's touching the handle to dispense water, you have individual bottled water as an alternative. So just thinking about those things in those common areas in break rooms. So these are some additional examples. We have outdoor smoking areas. You can see the yellow footprints to be a visual cue for social distancing. Bathrooms, if you don't have very many sinks, you can have dividers installed, those types of things, making sure that you have, you're keeping the soap dispensers and the towels readily available to encourage good hand hygiene with folks using your facilities.
So I mentioned at the beginning of this webinar, this is an evolving situation. There's evolving guidance that's coming out. Things are going, one thing we know is things are going to continue to change. We want to make sure that we're continuing to get you information that maybe changes. So we will continue to work on that and provide updates to you. We have everyone's email. As new guidance comes out, we will be emailing that out to participants to make sure that you are aware of that. Mindy, I guess I would ask you if there's anything else you would like to add from the health department perspective as we kind of close out this question and answer period and move into the closing segment here with Jolynn.
Thanks, John. Off the top of my head, what I could say is that I know that there are a lot of calls coming to us, and likely if you're not all from Allen County, perhaps you're reaching out to your local health departments there for interpretations of the orders, approval of plans or processes, those types of things. And we will just, if I could ask for a slight bit of grace, we need just a little bit of time to gather all the guidance from either the state regulatory facility entities that are over certain processes, as well as ours internally. While these were pretty good orders and pretty expansive, they were also a bit vague. So it leaves a lot to interpretation to the locals. So if you could just have a little understanding when you call in for your question or interpretation, that it might take us a few days, but that we will do our best to work through that and hopefully develop some resources we could post that might include some FAQs and things that we're able to gather. I've gathered from about 3 large state entities today, but many more to go. So I put that out there just to know that we're with you. We want to have these same interpretations ready for you, but it might just take us a little bit of time.
Thanks, Mindy. Appreciate that. Jolynn, I'll turn it back over to you.
Hi. Like I said earlier, I wanted to share with you, we have launched a Parkview Business Connect. And this is coaching for a safe-based approach to reopen your business. And we're launching it in a variety of areas. As you heard today, we had Gail Altacruz talk about the personal services that we provided PT. But you may think of us as healthcare, but we're the largest employer in the region. So we have a police force, we have clinical areas, we have office areas, we have 10 cafeterias. So we are learning as we go. And as we continue to operate in this pandemic, we really want to help leaders lead. So we've launched a website called Parkview Business Connect. You can either, there's resources on that website, industry-specific resources. I believe we're going to have a number of personal services resources up. If they're not up now, they'll be up very, very quickly. We have a phone number that you can call to talk to our subject matter experts for tips and tricks. And this will continue to evolve and change as the situation evolves and changes. So here's an example of our website. And here's the number that you can call.
Jolynn, thanks for that. I want to thank everybody for attending today. I want to thank our partners in this endeavor at Parkview Health, the Northeast Indiana Regional Partnership, Greater Fort Wayne, Inc., and the Allen County Department of Health. It's been our pleasure to bring you this service as well as all the other webinars and the information that hopefully helps you reopen in a healthy and safe manner. Thanks for being with us today. We're here to help you. So if you have any questions, please use that Parkview Connect hotline. Please call the Department of Health or call us, and we will help get you the answers that you need to help you reopen in a safe and healthy fashion. Thank you very much.